Hi, welcome to talk about trial of amitriptyline, topiramate, and placebo for pediatric migraine. Okay, in the definition, migraine is a common disorder in the children management. Estimates indicate that 3.5% of the children will experience recurrent headache consistent with migraine. Management consists of identifying triggering factors, providing pain relief, and considering prophylaxis.
More than 6 million children and adolescents in the United States have migraine headaches. Current clinical practice guidelines for pediatric migraine are based on expert consensus, given the lack of evidence for specific therapy. The CHAMP trial aimed to assess the benefits and harms of two of the most commonly used medications for the prevention of migraine in pediatric patients. This Phase 3 multicenter double-blind placebo-controlled trial was conducted in the United States and enrolled children and adolescents 8 to 17 years old with a diagnosis of migraine causing at least mild disability and a baseline headache frequency of at least 4 days per month. 361 patients were randomized in a 2:2:1 ratio to oral amitriptyline, topiramate, or placebo for 24 weeks. The trial was stopped early for futility. For the 328 patients with data to analyze, the primary outcome, a relative reduction of 50% or more in the number of headache days, was no different in the three groups, occurring in 52% of those in the amitriptyline group, 55% of those in the topiramate group, and 61% of those in the placebo group.
Okay, the application in medicine. We conducted a randomized double-blind placebo-controlled trial of amitriptyline. Topiramate and placebo is children and adolescents aged to 17 years of age with migraine. Patients will randomly assigned in a 2:1 ratio to receive one of the medication or placebo. The primary outcome was a relative reduction of 50% or more in the number of the headache days in a comparison of the 28 days baseline period with a last 28 days or a 24-week trial.
Amitriptyline is a prescription medication used to treat the symptoms of depression. Amitriptyline belongs to a group of drugs called tricyclic antidepressants, which work by adjusting the levels of natural chemicals in the brain. This medication comes in a tablet form and may be taken once or multiple times a day, depending on your doctor's instructions. Common side effects of amitriptyline include nausea, vomiting, and weakness. Amitriptyline can also cause drowsiness and dizziness. Do not drive or operate heavy machinery until you know how amitriptyline affects you. And do not drink alcohol while taking amitriptyline. Use this medication only as prescribed. To keep up to date with medication information, sign up for RxWiki Notify.
Okay, the pros. There were no significant between growth differences in the primary outcome, which occurred in 52% of the patients in the amitriptyline group and 55% of those in the topiramate group. There were also no significant between growth differences in headache-related disability.
Hi, I'm Dr. Paul. Welcome to another episode of Ask Your Pediatrician. The topic for today is headaches. Headaches in children. When should you be concerned? And we're also going to touch on migraines. So the headache that every parent is worried about, every time your child has a headache, you're thinking, oh my gosh, they must have a brain tumor, right? Well, thankfully, it's probably not a brain tumor. In fact, I can almost guarantee you, no guarantees in medicine, but literally in 25 years of pediatrics, I've had less than I can count on one hand brain tumors. I've had headaches in the thousands, okay? But let's address that headache that might be a brain tumor. This is a headache that gets worse and worse and worse, day after day after day. It's often constant, and it's especially bad after you've been laying down for a while. If you think of pressure developing in your head, and when you're laying down, gravity hits. So it's that headache that wakes that child up in the middle of the night that's at its absolute worst first thing in the morning. those are the ones you're going to worry about the most. You don't wait very long with a headache that's like that. It's waking your child up in the middle of the night. It's there. It's at its worst first thing in the morning, even if it's only been a week or two. If that's the pattern, get in and see your physician, your healthcare provider, somebody who really knows how to look at the back of the eyeballs, look at the discs, make sure they're sharp, and when in doubt, you can always do imaging. But like I said, for the thousands of headaches I've evaluated, I would say, I've had to send off for an MRI of the brain a handful of times because that's just not the pattern, right? The most common pattern for headache is that headache that's kind of worse as the day progresses, and that's more of your tension headache. It's sort of like a band of pressure classically, although kids don't always give you that classic, feels like I've got a tight band around my head, which is what you think of with a tension headache, worse as the day progresses. You can have a headache behind your eyes if you're, perhaps you've got some eye strain, happens at school, either just because of schoolwork or too much screen time, or perhaps you actually have a visual issue. So having the eyes checked is important, making sure the pattern doesn't look like that pattern for a brain tumor kind of headache. And then I want to touch on migraines. So the migraine headache, classically, there's this thing called an aura. So sometimes people with migraines will describe that they see flashing lights or they have some awareness that it's coming. And then they get this most intense headache, this throbbing typically, and nothing helps it except laying down and being very still in a dark, quiet place. And usually if patients with migraines will do that, within a few hours, it goes away or gets much more manageable.
Okay, that counts. Patients who receive amitriptyline or topiramate have higher rate of severe adverse events than those receiving placebo, including fatigue, dry mouth, amitriptyline growth, and paresthesia and weight loss in the topiramate growth.
Let's go over the side effects of amitriptyline. It is a tricyclic antidepressant drug, commonly used to treat major depression. The side effects of amitriptyline are not well documented, and the frequency or incidence of these side effects are not well known. Common side effects of amitriptyline include abdominal or stomach pain, nausea, vomiting, weakness, feeling a lack of energy, headache, dizziness, faintness, or lightheadedness. Other side effects include yellow eyes and skin, bigger or dilated pupils, getting a black tongue, constipation, decreased interest in sexual intercourse, diarrhea, hair loss, hives, red spots on skin, allergic reaction.
Okay, issues applying in the equator. In Ecuador, children or adolescents 8 or 17 years of age were eligible for participation. Inclusion criteria 16 or 17 include a diagnostic of migraine with or without area or chronic migraine without continuous headache, and defined by the International Classification of Headache Disorders.
Hey guys, this is Dr. Adam Tedder with Upper Cervical Chiropractic of Georgia. I'm a chiropractor here just northeast of Atlanta. I just wanted to chat with you guys today about some concerns that we've been seeing in the practice lately. We often get questions on the types of cases that we see, patients that we take care of, and being a family practice, we see patients of all different ages. And something we've been seeing a lot of lately is children with migraines. I don't know what the mechanism is that's causing this increase, but we've seen so many kids 8, 10, 13 years old, they've been having chronic migraines for years and years. A couple examples of these are, we had 2 young girls just in the last month, 13 years old, both of them been having migraines for 6 years. They take heavy medications, they've been in and out of the hospital. One of them, in fact, even when she would wake up from a migraine episode, she wouldn't even know who her parents were. And these parents were just at their end of their road. They'd been to all these doctors, tried all these different things, and the answer was always just another drug, or there was nothing we can do for you. Luckily for these girls, they were referred to the office, and what we found with them was a misalignment in the top part of their neck. This misalignment had caused a displacement of the head and causing pressure at the top part of their spine. Now, this pressure is what was causing that migraine. So as we took care of them, we started getting them adjusted and started to get their spine clear. The migraines have subsided. So within just a couple weeks of care, 6 years of suffering has now gone by the wayside. So if you know someone that is suffering from migraines, that is definitely something that could be an upper cervical issue, an upper cervical spine problem that we could take care of. Obviously, we never know that until we can actually check out the patient to see if that is the mechanism. But if we can help them, it can literally change their life and years and years of suffering that they don't need to be going through.
In conclusion, there were no significant differences in reduction in headache frequency or headache-related disability in childhood and adolescent migraine with Amitriptyline, Topiramte, or placebo-powered period of 24 weeks. The active drugs were associated with higher rates of adverse events.
Headaches are common in children and adolescents. By age 15, approximately 10% of all children have experienced a migraine headache. Migraines have been known to be hereditary, but even though scientists haven't really figured out exactly what causes migraines, we know that migraines are triggered by certain factors. They are caused by inherited abnormalities in certain areas of the brain. And a common trigger for kids' migraines include being stressed out, anxious, or depressed, changes in their sleeping patterns, meaning if they're getting 6 or 7 hours one night and then maybe 9 or 10 on the weekend, that might pose a problem for kids who suffer from migraines. Loud noises tend to cause migraines in some children. Certain foods and food additives and beverages. If your kid is drinking lots of soda pop, that high spike of blood sugar, and then the dramatic decline in their blood sugar. In other words, if your blood sugar rises really quickly and then drops after a couple of hours, that can pose a problem. So too much simple carbohydrate in someone's diet can cause migraines. Too much physical activity is the next one. And this one ties into too much time playing out in the sun. This can all lead to dehydration, which is the big factor here. And finally, girls with their menstrual cycle changes. Now, how can you relieve your child's migraines, or actually even prevent them, better yet? Well, the first thing you should try to do for your kid is to make sure they get into a regular sleeping cycle. They need to get that sleep. If they're not sleeping at least 8 hours a day, they're asking for trouble if they are migraine sufferers. Now, even though there are no drugs to prevent or treat migraines for kids, you can use I can't say that word for some reason, acetaminophen, ibuprofen, and naproxen. These are really effective. Matter of fact, for kids 12 and over, I recommend they take Advil.
Okay, thank you for your attention. Bye-bye.